Hello, I hope each of you is fine. Today, we want to ask all the questions you have about height increase surgery, and you would like to know the answers from Dr. Nader Motallebizadeh. Be with us. Hello, doctor.
Hello,
Good evening.
Good evening.
One of the most common questions your audience asks, is there a guaranteed limb lengthening surgery?
In the name of God. In general, in every surgery, there is no guarantee in 100% result from the doctor to say that something is definitely work. But our performance statistics, with regard to height increase surgery over the last 20 years, have shown good results. Fortunately, we are analyzing this information, and the results of about 400 volunteers who have increased height is good and positive. We can announce such information. The point to be made is that the problems that arise during height increase are divided into three categories: problem, obstacle, complication. This is based on Dr. Pirelli's classification as problem, obstacle, and complication. Obstacles are problems that can be treated without the need for surgery, like a tendon shortening that goes away with physiotherapy. Problems require surgery but can be treated, such as when bone is not repaired, which can be solved with a bone graft. Complications are incurable. It is like cutting a nerve when a tendon transfer is done. Complications may remain. The statistics we have show that our complications were very low. We had a problem and an obstacle, and their percentage will be announced.
What prevents a person from performing height increasing surgery?
Having underlying diseases, we do not recommend age over 40 years, and height more than 173 centimeters, for Iranian, in our opinion, does not require surgery. I would like to add one more point, and that is the lack of support from the patient relatives. In my opinion, it would be better not to do surgery if the relatives not support him, her. Because it really needs the support of the family.
Can children and adolescents who are genetically suffering from short stature be treated for height increase?
In a special case called achondroplasia, which is a severe dwarf disease in the trunk, is less affected by this disease, and the limbs are short, it is recommended to increase the height in 3 periods of growth, and the reason is that they grow as much as possible as their peers, to prevent mental and psychological problems. Because the difference in height with the others and the reaction of other children with them creates a lot of problems for them. In 3 periods, each time between 6 to 7 centimeters is recommended to be done every 3 or 4 years.
What are the complications of height increase surgery?
If the operation is not done correctly and the surgeon is not experienced enough, nerve damage, tendon problems, delayed bone repair, all of these can be complications. And that is why it is recommended that anyone who wants to have height increasing surgery, from the doctor who accepts the surgery request, to have a face-to-face meeting with at least 20 people who have had surgery to evaluate the quality of the result.
After the height increase operation, when can a person do his personal work? And when can he return to his normal life?
They can do their personal work from 4 or 5 days after the operation. But whether he wants to return to a normal state of life depends on several factors: age, rate of increase, gender, weight. We have to evaluate these 4 factors. Then we can determine the time of return to normal according to our own statistics.
میتونه برگرده به
به
محیط
زندگی.
زندگی من.
درست. اصلاح پای پرادیس
Is it possible to correct a bow legs with height increase surgery, and what factors depend on it?
به چه عواملی بستگی داره؟
در
In the
همون
very
عمل
first surgery,
اول
we correct the
انحراف
deviation of
زانوها
the
رو
knees.
تصحیح میکنیم.
Of course, if not too
البته
severe.
اگر خیلی شدید
That is,
باشه.
if the
اگر
person
خیلی
stands and
شدید
holds the
باشه،
ankles
مثلا
together,
می‌تونن،
if the distance
در
between the
نظر
knees
بگیرید
is
که
not
اگر
more than
فرد
7 centimeters.
کیسه و مچ پاها
Usually in the
به
first
چسب
surgery and when
فاصله
installing the
بین زانو
device, we also
اگر
correct the
از 7
deviation.
سانتیمتر بیشتر نباشه، معمولا تو همون جلسه اول ما میتونیم در عملی که داریم دستگاه رو نصب میکنیم انحراف رو هم کاملا تصحیح کنیم.
بسیار. توضیح روش
Explain about the LATN method and how it is done and for whom it is suitable.
مناسب چه فردی هست؟
We use LATN for people who are very short. LATN stands for lengthening and then nailing. First, an external fixator is installed on the foot. When the increase is done, we install the inner bar and remove the external device.
داخلی رو میگذاریم، دستگاه بیرونی رو برمی‌داریم.
درست. توضیح
Explain the
روش
LON method.
بفرمایید و اینکه
Who is this method suitable for?
و چه کیس‌هایی مناسب هستند که با روش LON این عمل براشون انجام بشه.
معمولاً
In men or women with a height of 150 to 170 centimeters, we do either LON or MTN.
یا الوان میکنیم یا MTN.
درسته.
برای
خانم‌ها هم
خانم‌ها
امکان
بله
پذیر
بله.
هست. روش
Explain about the MTN method and who is suitable.
فردی هست.
In MTN or manual telescopic nail method, an internal rod is installed and no external device is installed, except for a small screw that the person turns by hand. It is much easier than other methods. It has fewer restrictions, the person returns to normal sooner, the course is easier, the scar on the skin is less. These are many advantages.
Does it hurt less?
آیا درد کمتری هم
Yes, definitely less pain.
Explain about the cross method and what conditions a person should have in order to be able to perform cross surgery.
جراحی کراس باشه؟
I do not recommend for Iranians, and they can do the tibia first. When they are done, they can do the next surgery for femur. This is a normal situation for people abroad who want to return sooner. The way to do it is to do one surgery on tibia on left leg and the femur on the right leg. After it is done, we operate on the opposite side of them that was not done. Because part of the recovery period and bone formation of the four bones coincide, the whole period becomes shorter. I said when person have a short stay in Iran, this method is more appropriate.
So it is more suitable for people outside of Iran who come to you.
Yes, it is not suitable for Iranians.
پس بیشتر مناسب افراد خارجیه. توصیه می‌کنم.
برای ایرانیان.
برای یک فرد عادی
What does a normal person need before he or she grows to have the desired height increase?
قد مطلوب رو داشته باشه.
The most common cause of short stature is poor nutrition. Usually children who do not eat well find this problem. This malnutrition may be due to mental issues or environmental issues, which is another matter. Of course, this question is in the field of pediatrics. Orthopedists are less involved in this issue.
این سوالی که شما فرمودین در حیطه تخصص غدد اطفال هست. کمتر ارتوپدها ورود پیدا میکنن به این مسائل.
آقای دکتر تناسب بین میزان
What will be the proportion between the amount of height increase between the legs and other limbs like the hand?
ما درست رو افزایش پا کار کردیم و جاهای دیگه به دست نخورده. میخوایم بدونیم که تناسب اینها بعد از عمل چطور میشه، به چه میزان خواهد بود.
We generally evaluate people before surgery. The size of the forearm, arm, femur, tibia, and trunk and the ratio of these to each other are very important and considered. We do not give a positive answer to everyone and we reject many because of these measurements.
The question that women ask a lot and are worried about is scars after surgery and how to fix them.
In some people, scars cannot be removed the way they want. It depends on the genetics of the people. For some, it's really bad scars. The sensitivity of the person to this issue is very important. What we do for this issue is that, before performing the surgery, we let the applicant directly meet with people who have performed the height increase surgery. And to see their scars, it helps a lot in their decision.
Thank you for your answers. Thank you for your look and attention, and I hope we answered your questions.